In these facilitated role-play sessions with simulated patients, we have 3 patients. The first is a man with Crohn's disease who develops a new type of rectal pain. The second is a woman with abdominal swelling and pain, and the third is a teenager with vomiting and hematemesis. In all cases, the clinician receives input from the group in order to improve his or her interview technique, and in each case, the newer method yields more clinically relevant information and a deeper understanding of the emotional context of the illness.
Hi, good morning. Hi, I'm Ray Miss. How are you?
Rob Smith. I'm okay, I guess.
Hi, Rob. Nice to meet you. Welcome. So what brings you to my office today?
I don't know how much the referral stuff told you, but I have Crohn's disease. Mm-hmm. Yeah, I've had it for a long time. It's kind of well managed, and I don't know. Recently, there seems to be a flare up. Something's going on. I don't know what it is.
Right.
So I'd like to find out what it is and get rid of it.
So how long have you had Crohn's disease for?
Oh gosh, 20 or more years. I was like a teenager.
And have you followed with another gastroenterologist or stomach doctor? Have you followed with another stomach doctor?
Well, I've seen other people over the course of that time, but really it hasn't been debilitating in any way. I mean, I've been managing it. I have medication. I'd rather not have it, but it's okay.
And what are the new complaints? What kind of problems are you having?
Well, the last 3-4 weeks, it just seems to be there's a kind of a new pain, discomfort. Pain may be a little severe, but I'm feeling like this kind of chronic, kind of dull, achy heaviness.
And where's that dull achiness located?
It's kind of right in my butt.
And would you say it's around the rectum, or is it around the buttocks?
I guess more the rectum.
The rectum. And do you experience that every day?
Yeah, it's all the time.
Have you ever had something like this before?
No, this is new.
It's new.
Yeah, this is new.
And do you experience it continuously, or does it come and go?
No, it's all the time.
It's all the time.
Yeah.
And what does the feeling do when you have a bowel movement?
There's some tightness, maybe a little bit of cramping, but I seem to be having, it's a little embarrassing.
That's okay.
I seem to be having more diarrhea.
And is that correlated with the pain, more diarrhea with the worsening of the pain?
Well, I mean, it seems to be all of a piece. I'm not really sure I understand exactly what you're asking.
Well, for instance, you say that you're having more diarrhea. How many stools a day do you have?
5, 6.
And the consistency, is it formed, is it loose?
It's more loose than it was.
How about any rectal bleeding?
No.
Do these symptoms awake you from your sleep at night?
No, I sleep okay.
You sleep pretty good. And so none of this wakes you up from your sleep? And with the same respects of the rectal pain or the discomfort that you have, is it made better, worse, or no different with the bowel movement itself?
Doesn't seem to make a difference.
Okay. And with this too, has anything new happened in your life recently, in the last 6 weeks? Any new medications, any new issues that have arisen right around the same time?
I really can't.
Well,
I'm trying to think,
Can you give me an example, such as, have you traveled anywhere recently, or any?
Yeah, I travel for work almost all the time.
You do.
But pretty much to the same places. I mean, I'm a consultant in kind of major metropolitan areas.
Okay. And at the same time, any new medications?
No, I take Lialda and been taking that for a long time. And, occasionally, if I get a flare-up, then my internist gives me some prednisone for a couple of weeks, and that seems to help.
And when was the last time you were on prednisone?
Gosh, probably 5, 6 months.
Okay.
It's been a while.
And have you had a colonoscopy recently?
About a year ago.
And do you remember what they found?
They said they didn't find any change in it at any kind.
Okay, but these symptoms are clearly new and different than what you had before. Have they ever given you rectal therapy or topical therapy for your Crohn's disease?
No.
No, I'm here too. Are you married?
Yeah.
And did you have any children?
I do. I have 2 kids.
And how is your family at home? Does anybody else have any similar symptoms of diarrhea?
No.
Do you take any other new medications? Other than the Weolda, do you take anything else?
No, I really don't.
Rob. So Rob, how are you feeling during this interaction as a patient?
Feeling not very comfortable right now. I feel as though I'm being asked a lot of staccato questions, and so I feel as though I just want to say as little as I can.
I see. Okay, so is there something that you feel like you would want to say if you were given that opportunity?
It's a loaded question.
Yeah, but
Are you feeling that there's something you want to say?
I am. I feel like I'm kind of not being given the opportunity to go, or the permission to go where I want to go.
do you think this is a place that we could try to get some feedback on that and then continue, or just now that Ray's aware of that?
Well, we can ask Ray
Yeah, so
if he's communicating something else. If you're content, are you content with the history at this point to move on, or do you think you need more?
Well, you know, I kind of didn't go through my, past medical, past surgical. What I like to do is get some of the subjective complaint and then go into the past medical, past surgical history. And then kind of like where that review assistance would be is open it up, to open the door of what else he needs to talk to me about.
I think for the purposes of this, and I understand because that's what you would normally do in
Right.
history, but maybe you could ask him those types of questions if you think it's really relevant for what he's coming in. Because maybe that wouldn't be as relevant, and we're going to assume that you've looked at some of the, since you're a specialist, looked at some of the previous history, so you might want to ask him if you think it's relevant. And really get more at what the issue is that you came in.
One of the hints is, if you remember from the video, naming the emotion or addressing his state. You seem a little distressed, or, is there anything more you need to tell me?
Right.
Just giving the opportunity and allowing that silence might allow that to come out. And if you feel that you're needing more medical information, fine, but I think for the purpose of the exercise, as Lynn said, maybe we should move into that and see what we can.
Okay.
Does that make sense to you?
I said okay.
All right.
So you seem a bit distressed and came to see me as another opinion. What concerns do you have today?
Well, I've had this Crohn's for a long time, and I've had flare-ups, and I get the prednisone, and something's going on that's new. I'm just convinced of it, and I'm worried. I'm just plain worried. I don't know what's going on, or did I do something to? Is there some new condition that I need to be treated for? I don't know what questions to ask here.
Well, and that's part of my job is to ask the right questions to you. And what are your fears?
Well, okay, you gotta promise you're not gonna judge me here, right?
I'm not here to judge you. I have to take care of you.
All right. I guess I'm on the road a lot, and while I'm married and I have kids and all that, but I have a different lifestyle when I'm away from home, and I'm wondering if something that I have done has made me sicker, or has made me sick in some new way, or am I just or is this just another aspect of the Crohn's, and I'll keep taking the drug and I'm just worried about nothing.
Can you tell me a little bit more about your activities?
Yeah, and you're right, I'm not being fair. I'm bisexual. No, I'm actually, I'm cheating. I'm gay. And, but not here. I really have two different lifestyles. And I'm worried that I may have picked up an infection. I may have an injury. You know, I don't know. It's not something I can kind of just go around talking to people about.
Right. And as your doctor, my job is to take care of you. And what goes on in these rooms will stay in these rooms. And what I need to do is I need to give you peace of mind. And I think we need to work together on giving you some answers. And I will probably be willing to do some further testing, and we can talk about that if you're willing.
Can I ask what we would be testing for?
Well, I mean,
Any possibilities here?
with rectal pain, as you described, you know, the big thing we would want to know is if there's any rectal trauma. Have you had anal intercourse?
I have it.
Yeah. So I think, you know, there are different diseases, including just simple trauma, that can simply be treated with topical therapy versus ruling out potential infectious causes. But together we can work together and try to get you some answers if you're willing to do a little bit more testing. And we can start off, if you would agree, to some simple blood tests and maybe some stool studies. I'd like to do a rectal examination today, if that was okay with you, to get you some further answers before you leave the office today.
Yeah, I'd like to have some answers as soon as I can.
And I can do that for you. And I do. Now, with respect to these symptoms, you've never had, did anybody describe to you before that you've had Crohn's disease of the rectum or the anus?
The doctor said ileal colitis, and I'm not positive I know what that.
And that doesn't surprise me because, you know, 50% of patients with Crohn's disease have disease in this area, and that's pretty typical.
Yeah.
But with the rectal complaints, now that certainly seems new, and I think we need to give you some answers with that. In addition, you know, it sounds like, you know, we may need to kind of give you some counseling about what to do about your practices. Do you practice safe sex when you're on the road?
The answer is yes, although there was an episode not too long ago in which I drank a little too much, and so there was this one episode, which makes me wonder, because I'm not an idiot, it makes me wonder, you know, could this be HIV? Right? I mean, I'll tell you that since I've been feeling this, I've been really kind of avoiding my wife completely, because if there's an infection here, you know, then I gotta deal with that. But if there's an infection here, then I also have to explain that. And I don't want to go there.
Is your wife, is she aware of your bisexuality?
Okay, we're gonna go ahead and stop there.
Okay.
Okay, so what did you feel, Ray, about that second part of that interaction?
Well, as the clinician, you know, now that I do, I need to get directed, but I see a patient here that's suffering physically and emotionally. And this is pretty heavy for a simple visit with respect to his sexuality, and it goes deeper than that. But, you know, I needed to give him the time to explain himself, because this was very difficult to him to probably share with somebody. At the same token, I had to be sensitive to that, because I didn't want to shut him down, because there are needs that need to be met here. So to slow down and opening up some pause and allow him to explain himself was easier. And I think as a private practitioner coming in, I think, you know, you had talked about really about the doctors. You know, we're sometimes up against the clock. We got to get in there, you know, spend time with the patient, but, you know, certainly be very effective in that brief amount of time. So I think I got caught up early on in that, you know, fire the questions, why are you here? You've seen obviously other doctors, and then really to kind of sit back and be sensitive to the fact that there was something deeper.
So how did you feel during the first part where you were trying to get that information versus the second part? How did you feel as a physician who was seeing a patient?
Well, you know, I felt more relaxed the second time around, but I also felt, you know, being on a stage and trying to get to the point of acting, you know, maybe a little off, but it's probably not much different than what we do in our own exam rooms.
Okay.
So it's trying to get people on track. I can tell you as a clinician, if you felt a little uneasy, at first, I'm sure more people feel that way in the office. But I also, I think as the patient understanding with the doctor, we have a schedule to keep. It wasn't my intention to put a wall up with him. And that's hard sometimes because I feel myself as a people person, and it's maybe something I need to be more aware of. You guys are giving me insight now. I have to do on a day-to-day basis, so.
Well, let's ask Rob how you felt as a patient.
I felt that I could take a chance. I felt that I was being listened to on a deeper level. The eye contact became much clearer to me. And also what you're doing right now, there's a lot of nodding going on.
Right.
It's okay. And the reassurance that you gave me, that nothing's going beyond this room, it allowed me to be honest. Because I didn't want to be honest. Right. I mean, I wanted you to just give me a pill and send me home.
Right.
So I appreciated that. Also the fact that we kept a kind of very even, low volume, kind of thing. I felt much better. I felt that I was going to be taken care of.
Hello, Dr. Hackworth, how are you?
Hi, nice to meet you. I'm Calista.
How are you feeling today?
Doing pretty good.
Well, I was just reading through your records from your other doctor, and I know you've had a number of problems for several years now. Can you tell me how this all started?
Well, it's just, I've had this kind of aching, kind of almost emptiness feeling in my lower abdomen for a number of years, 2 years now, and I'm not really sure what's going on.
So the main problem is a sense of achiness and emptiness?
It also kind of comes and goes with a swelling. It almost feels like I'm pregnant or something. It comes out.
Mm-hmm. Do you remember how this all started?
I don't know how it started. I know that it started after I had a surgery a couple years ago. I had cervical cancer, so they did a hysterectomy. And just kind of started after that, so I don't know if there's some connection or...
What other symptoms do you feel other than this blood?
Well, like I said, it's like an aching feeling, the swelling, and just it's like an achy, empty feeling.
Have you seen a change in your bowel habits?
No.
Do you have any nausea, vomiting?
No.
Is this do you have this symptom every day?
Pretty much every day, yeah. I mean, it seems to get worse at night, and like when it's kind of bloated out by the morning, it seems to be back to normal, but then I'll just...
Mm-hmm. Are there things that seem to make it worse?
I haven't really noticed.
Does this seem to be interfering with your work?
I haven't missed any work, or it's not that severe. It just has me a little concerned.
So you mentioned this all started around the time of your surgery for cervical cancer.
Mm-hmm.
I imagine that was a pretty stressful time for you.
It was stressful. I'm really, really grateful that they took care of it, and doing better now. Don't even have concerns about the cancer coming back. They did everything they needed to do.
You know it's gone and you're comfortable.
Yes.
Okay. What do you think might be causing your symptoms now?
Honestly, that's why I'm here. I really don't know.
So I'm the doctor and I'll figure it out.
Okay. That would be great, because it's been going on for a couple of years, and honestly, I'm kind of beginning to wonder if anyone's going to help me.
When, after your initial surgery, did these symptoms start to develop?
It seems like it started within the couple months following my surgery.
Was it something that sort of gradually worsened, or did it come on suddenly one day?
It seems like it kind of just came on, but it's gotten worse. Like actually last year, I remember it got pretty bad, and that's when I came. I think you have my records. I came and I got a whole workup, and they didn't find anything at that time. And just recently, it's been getting worse again, and yeah, just not really seeing what's going on or what I can do to help it.
I'm going to stop here for a moment. How are you feeling it's going so far?
Well, I feel a little wall.
You feel a little?
A wall.
A wall, okay.
She has these symptoms, but she almost seems a little indifferent to the symptoms. She says, I have this problem, but it's not affecting my work. I know it's not the cancer. Nothing's really worked, and I want an answer, but it's almost like it's no big deal.
Although she did say it's not affecting my work, but I'm concerned.
Yeah.
Is there any other information that you think that you need to get from her, and a way that you could ask that?
Well, I've been trying to see if there's some stress or stressors, but I haven't directly asked her whether stress is causing or associated with her condition.
How do you think you can maybe ask if there's something else going around, or if there's any associated issues?
I suppose I could segue in with your surgery and cancer diagnosis must have been very stressful. Who did you turn to for help? How did that make you feel? Are you feeling the same way now?
Because I was thinking maybe also you could say when she gave you that opening is I'm doing okay, but I have concerns, and she came here, you could say, could you tell me more about what concerns you about these symptoms? And then maybe she would go deeper into that. That's one other possibility.
I think I'm feeling similarly to what you all have pointed out. I actually do feel pretty comfortable with you. There is kind of a relaxed energy that you're bringing that's making me, I don't feel uptight around you, and I also do feel stuck, like we're not getting anywhere. And not that we're not getting anywhere, but we haven't gotten to anything that's going to bring us to the next place.
Do you know what you want to say, or you don't even know what you want to say?
I don't really know what I want to say.
You just feel that there's something
Yeah.
there, but you don't know what.
Yeah.
So now let's assume this discussion never happened, but you heard what she was describing. Bloating, emptiness, like I'm pregnant is what she said. Okay. Oh, how smug he looks.
So I understand you're an attorney.
Yes.
My sister's an attorney.
Oh, really?
Yeah, she recently got out of trial work. It made her too nervous and anxious, so she had to, she's basically paralegal now.
Oh, okay.
Do your symptoms interfere with your performance at work at all?
I notice them, but I just kind of have to put them on the back burner.
And you're able to do that pretty well?
Yeah, I mean, honestly, I get a little self-conscious when I feel like, I've actually had to feel like I have to loosen my belt. But yeah, I can power through that and get through the day.
Is there someone at home that supports you?
That I live with? No, I live alone.
Do you have any relationships, close relationships?
I have friends and family. I'm not married, I'm divorced.
When were you divorced?
It was 4 years ago.
So you didn't have a significant other when you were diagnosed with cervical cancer?
No.
Did you have any children during your marriage?
No.
I guess you won't be having any children now.
I guess not.
feel?
How would it make you feel?
Different people place different values on children. Some people don't want them, some people do.
Right.
I'm guessing you would have liked to have children.
I would have liked to, but that's not really in my control now, so you just move on.
You think you've been able to do that?
I have to do it every day, so done it to the best of my abilities. I can't dwell on something that's not going to happen.
Are there, do you think there's anything in your life that could replace the experience of having a child?
Honestly,
Thought about adopting, or
I'm sorry?
have you thought about adopting a child, or being a foster parent?
No, I have not.
What we're going to try here is Dr. Drossman's going to try to do the interview and
Well, not the whole interview, but
Huh?
from this point.
Yeah, would that be okay?
Sure.
Okay, because I think we don't have that.
You've been,
You can salvage it.
Dr. Drossman?
So we'll take, we'll be somewhere in the middle. And, so you said, tell me again the symptoms you had.
It swells out, and there's like an empty, aching feeling.
Okay, anything else? Any others?
And sometimes it feels like I'm pregnant. It's just,
Like you're pregnant. Do you have any children?
no.
Okay. Then you said that this began about 2 years ago when you had the hysterectomy, is that right? Tell me the circumstances around that, how that happened.
Well, they, discovered that I had stage 2 cervical cancer, and then they said that the way to deal with it is to do a hysterectomy. So they did.
What was your response to hearing that?
I was, happy that they knew what to do to take care of it, and then just, okay, do what you have to do.
Any other thoughts or feelings? Sometimes we have more than one thought about these things.
I tried not to think too much, but I guess it kind of occurred to me that I wasn't going to have kids now.
And
That was
I
over.
heard you don't have children now.
Yes.
So that must have been a big hit for you.
You deal with things, right? You just.
Well, is there anything more you can say about what happened after the operation, how you did?
The doctor said I did really good and everything was gone, and that there was not going to be any more fear of the cancer coming back. So.
How, after you found out about having the operation, how was your mood?
God, it's interesting that you asked that. I guess I did. I was depressed for a few months. I was pretty down.
I was wondering what went through your mind at that time, what you were thinking and feeling after that.
I think everything just hit me. Just to be so young and to feel like this whole chapter of my life was closed. It was just.
You were how old?
It was 31.
Oh, that's got to be hard.
Yeah. I was pretty down for a while. But, sorry.
Okay.
Thought about that for a while.
How much do you think these thoughts and feelings are still there?
They come up honestly when I'm with my brothers and they have kids, they each have 2 kids, and I always thought I was gonna have 2 kids. I was gonna have a boy who was 2 years older than a girl. It was just, I don't know why, and just seeing them running around and laughing, and it just hurts me every single time, and I don't even want it to. I don't even want to think about it. I just can't help it.
Yeah, oh, I understand. I mean, having a hysterectomy at that age is a loss. I mean, it's a loss like anything else. It's not just losing the uterus, it's losing sometimes a sense of yourself and your aspirations and your thoughts, and so that's something that you have to grieve as well, just as if you really had a loss of a child or something like that.
That's so interesting, because that's almost what it feels like, but I've just never thought of or said that, or...
And sometimes those feelings and even those symptoms can stay there as a way to kind of hold on to the wishes, the dreams, so that it's hard to give up. And I think just like when you lose a parent or something like that, you have to go through a process of you accept it in your mind, but you have to give it up emotionally. I don't know if you've thought about it, if this is coming up a lot, if you'd like to talk about it with someone more and see if this can get you to a better place about it.
So just to be clear, are you saying that you think that what I've been experiencing is connected to this?
I don't know. I just know it happened around the same time. Did you have thoughts about that?
I just hadn't really, I mean, is that possible from a medical perspective?
Anything's possible. I think I'm going to continue to work with you and work with the symptoms as well and try to get you feeling better. I also think that you may not be in the place you want to be now in terms of how you think about these things, and that's a transition that we might like to try to make for you as well. Maybe it's something to think about. I know you have a 7-hour drive home.
How did you feel during that interaction?
I just felt so relaxed, like stuff was just unfolding, coming out, and I was just kind of like almost like watching it come out, you know, like I didn't know, and so it was just like a lot of deep breaths, like, and also felt very heard.
Yeah, that was interesting that how you mentioned it, because it's something that you didn't actually realize yourself, but as it was coming out, it was almost like you were describing as a third person, like watching yourself, you know, convey things that you didn't actually realize you were feeling. So that's kind of interesting.
Yeah.
Hey, Adewale, it's nice to meet you.
Yes.
Okay, so what brings you into see us?
Oh, well, I probably got into the emergency room a couple of days ago.
Okay.
I drew up blood, so I figured out, did the endoscopy, there's a tear on my esophagus.
Okay.
All of that.
Okay. So, is there, so I understand you had this episode of vomiting, vomited up some blood, went to the emergency room, and then you had the endoscopy done and they found the tear. Is that right? Okay. And so, what is this? Do you know what the specific reason for you being referred here is? Are there any specific concerns that you have that need to be addressed, do you think?
Well, I just want to stop that from happening again.
Okay.
And yeah.
So when you say stop that, do you mean like the vomiting, like the bleeding? What specifically are you talking about?
Yeah. I want to not vomit blood again.
Okay.
It's a little disruptive.
I understand. Okay. So has this happened before? Was this the first episode?
That's the first time.
Okay.
Yeah.
Okay. And have you had any GI problems in the past? That has happened?
Well, I have heartburn, a couple times a week.
Okay.
But that's, I don't know if that's connected. That's generally. I generally have symptoms of that. Yeah.
And do you have any specific concerns around this episode of vomiting that you think we need to talk about, or you think needs to be addressed?
I think there's a possibility of it happening again.
Okay.
So, yeah, the normal vomiting isn't unusual, and I don't want it to, I'm in school,
Okay.
I don't want that to get away.
It's understandable.
Yeah.
And I'm just wondering why you are concerned that this may happen again. Are there any specific reasons why you think this may happen again? Any specific concerns that you have about that?
But I think it might happen again because I mean, it was very normal going up to it. It wasn't anything unusual. It didn't hurt more. It didn't. And it's, I guess, the main thing. I mean, it didn't feel odd. It just was blood.
Okay. And is it the blood you're concerned about, the fact that there was blood in the vomiting, or the fact that you vomited? Which of those is the more concerning issue to you?
The blood is obviously more upsetting.
Okay.
That's obviously the reason I'm in here. But I want to stop them.
I'm sorry,
I want to stop them.
you want to start off?
Yeah.
Okay.
Yeah, can we stop here for a moment?
Absolutely.
Okay. So how are you feeling?
I mean, my initial reaction was, you know, she had this one episode of vomiting. She's concerned that it may happen again. And I think, you know, there has to be a reason why there's something that has not been addressed. And then I asked, I said, you know, have you had episodes of vomiting in the past? And she said, no. So she had this one episode and she's concerned that it may happen again.
Right.
So initially I was thinking, okay, is there maybe some type of eating disorder type issue that underlies this and that needs to be addressed, and that's why she thinks it may happen again?
If you think that, how would it be best to get around to that without maybe coming right out of the
Yeah.
What do you think?
So my attempt at approaching that was asking about previous, you know, has this been a problem? Has vomiting been a problem? You know.
This wasn't quite moving forward like
So
you would
why-
want it, but you were doing that.
It's the right questions, but
Yes.
why are you stuck again? What's sticking out to me is that there's unbelievable emotion, anxiety, all sorts of emotion, and we have to somehow address that because we don't know if she's just afraid to talk to you, if she's got something she really wants to say. So one of the ways you can do it, especially with an adolescent, is say, this must be hard to talk about. I suspect that would lead to her better able to, because your questions are right. What's difficult here is that she's not, well, let me ask you, how are you feeling about talking your story at this moment?
It didn't feel like we were on the same level.
Okay.
It felt very much high up, low down. So I didn't feel comfortable enough
Okay.
to actually divulge it.
How would you like it so that it seemed a little more equal ground? What would happen to that have you feel that way? What would you need to happen?
I think just in the initial coming in, a little slowing down there, because you did slow down later, which is great, and you left me this space. And maybe, let's say, something more specifically, slowing down there, just something in the eye contact and the posture. I guess it just felt a little, it's like, okay.
Try it with some validating statements, you know, that it sounds like you've got something very important to talk about, you know, anything that would make a bridge It's where she is emotionally and process-wise. Then the content will come.
Okay. So it sounds like there's something you want to talk to me about, that you're concerned about. Would you want to?
Yeah. Is that what's unusual?
Okay.
The vomiting's not. I'm figuring that's why I think the blood might happen again. And if it's progressing, that's bad.
So the sense I get is that this is something you're really concerned about, and the issue of vomiting is something that you may have struggled with a little bit, and something we probably need to address to see if we can reduce the likelihood that this will happen again in the future. Does that sound right?
Yeah, that's right.
Can you tell me a little bit more about vomiting and the kinds of concerns you've had about this in the past?
Let's see. I mean, it's been going on for a while, so it wasn't as concerning until obviously episode there. It is, I don't want it to happen anymore, and I have been trying to stop it, and I can't.
So when you say it's been going on for a while,
Yeah.
how long is a while? How far back has this been a concern or an issue?
Senior year of high school?
Okay. And okay. So I guess my challenge now is, I think I know what the problem is. The challenge is, how do I address that in a way that is not threatening, because I don't want her to close up again.
Right, it's the same as the patient before.
Yeah.
Go back to let her tell you her story. Because if she goes into the story, all the emotions will come with that, and her willingness and ability to talk about it further. Because what you're getting now is only to a point, because there's still this tentativeness.
Yeah.
But bring her back to the moment. How did it begin?
Okay.
You know.
So can you just tell me how all this started?
Okay. It's around prom, senior year.
Okay.
It's just, I used to not be this size. And you know, there's a lot of popular girls, and they look good, and you want to match that. Let's see, there was a lot of pressure from my boyfriend at the time to do other stuff. I guess a lot of pressure.
Okay.
I guess. And it just started being a regular thing.
Okay.
It's like after the prom dress shopping and wanting to fit that.
So, what have you heard?
That it's clear to me that this is an eating disorder, and she has a lot of social pressures, and that is what led to this becoming a problem. But it sounds like she does have some insight into what is going on, and she is open to addressing it.
Yeah, what I heard is that she had pressure because she wasn't the same size.
Yeah.
And she was having pressure from her boyfriend for other stuff.
Yeah, I heard that too, but I wasn't sure if I needed to pursue that because maybe I should have asked, are you still with him now and things like that because.
How about, what do you mean by other stuff?
Yeah, so I wasn't, because
Well, I can see where he's coming from. That is, he's asking to divulge a lot about the bulimia, and if you all of a sudden go into that and she shuts down, she might shut down on both. I can see where he's coming from, but I can also see why it's important.
Yeah. Because I heard the other stuff, and what came to my mind was, was he pressuring her for sexual intercourse and things like that? But will that take me off course? And we start.
You won't know till you ask. I mean, I think the thing is, if it's meaningful, she threw it out to you, so it's maybe a hint. So if you ask, and she says, well, I don't want to talk about that, well, that gives you good information, as well as if she talks about it. Either way, it's data. It's just that you have to go with it's all active listening, going with what you're hearing and taking it to another level by asking about it.
Did stuff you shouldn't have. And it's always made that issue difficult.
Okay. And do you think that, in your mind, do you think that these things that you are talking about, do you think that they're playing any role in what is going on now? Do you think it's driving some of the issues that we're talking about? How have you thought about this at all?
I mean, initially, yeah, it played a factor. Now, I'm not so sure. But yeah, that pressure.
First of all, I just want you to know that I appreciate you opening up to me and talking about these things. I know that it's very difficult to talk about. Okay. And we will work together, okay, to see if moving forward we can try and pull these different pieces together to address the concerns that you have. I have some colleagues who can be involved in the care, if that's okay with you, and we can discuss this a little bit more. We have psychologists who have a lot of experience dealing with GI illness and some of these issues that play into GI illness, and we can all work as a team with you to address your concerns and to see if we can minimize the likelihood that these are going to be a problem in the future. Okay, we will work with you, and we're going to make the schedules are going to make appointments for you to come and see us. And we'll take this one step at a time.
Okay. What's your thoughts about how you think it went after we took that break?
It was an eye-opener that she said she didn't feel comfortable. This was the physician, and you're out there, and I don't feel that I can discuss these issues with you. And it was my job to make it okay, to create a safe space, to let her know that I'm interested in listening to these things. And in her mind, she may or may not have drawn any connection between these. Okay, I was abused as a child. My boyfriend. It's still not clear to me. There may be more around the boyfriend. He raped you, right? Your boyfriend?
That was earlier.
Okay,
that was early on. So I wasn't sure if the boyfriend also had done stuff to her.
Right.
And was just pressure. Okay, so I wasn't clear about that. But bringing all these things together and making her understand that it is, one, there may be a connection between these things, and two, it is okay for us to address them. I am interested, and I want to work with you to help alleviate whatever problems this may cause.
How did you feel?
I felt the eye contact got a lot softer. I don't know if you could feel that, but that let me open up. Because you had the eye contact before, but it felt a little more harsh.
Okay.
And that was just accepting and opening. So that was great. you give me the time to get into the deeper stuff. Just tough, because I know it took a lot at that one particular moment.
Did you feel like you wanted to say more?
I felt like I could, yeah. I felt like I was comfortable with you and coming back to see you and getting into that deeper. Yeah.
I mean, my thing was, you know, these kinds of situations, sometimes I'm a little hesitant to push too much all at once, especially if this is a patient that I'm going to see, you know, over a period of time. So, I guess.
You acknowledged it, that this was something that you were going to follow up on.
What we're really doing is creating a patchwork of information. The medical diagnosis will come out, but you don't have to do history of present illness, past medical history, social history, because it's all that context.
Though, you know?
You're trying to get the psychosocial context with the symptom development. What we're trying to do is build the doctor-patient relationship, and then that can be helpful for. He's not necessarily going to treat the eating disorder or necessarily the abuse, but he's got to be the gatekeeper for that.
And I think the success of subsequent treatment at the eating disorder unit may be dependent on the relationship that we form. Because if I'm going to refer, I don't want her to feel that I'm just pushing her off and saying, okay, you know, move on and let someone else deal with this.
Yeah, he said we'll work as a team.
I want her to know that I'm interested in addressing you as a patient, and I have colleagues who will work with me to address what those issues are.
You know, one of the things that I thought was great that you asked was, okay, now these things there's other things that go on that may or may not have an impact on these GI symptoms, but it will help me just to understand that a little bit better so that, you know, so that we can, I mean, I would bring it back to what you did, you know, so that we can solve your problem a little bit. And it gives you permission to go into some of these other areas that you would say, why is my gastroenterologist asking about my early sex life? Then, but you, the way you asked it gave permission to you to bring this up, and it wasn't that is the cause or not the cause. I don't have enough information, but I need to get more information so I can determine, and we can determine whether that was the cause.
And that was what I was trying to do, because my concern was, I didn't want to imply that that is the cause. Because in her mind, she may be like, you know, why are you trying to force this relationship between these two things? And that's why I said, well, it may or may not be, but at least let's explore it. Yeah.
I just think this is very natural. I mean, and the actresses are just so natural.
Oh gosh. Yeah.
Okay.
Okay, thanks so much.
Thanks.